In the 20th century, the way we learned that people had heart disease or had atherosclerosis or plaque was when they had their heart attack or stroke. The problem was that 50% of the men and 67% of the women died of sudden death at that moment if it was, say, a heart attack. In the 21st century, we're discovering that you can actually look back further in that person's life and discover the atherosclerosis, or maybe even go back further and discover, if you will, the garden that allowed that atherosclerosis to start growing. With me today is Dr. John Osborne of State of the Heart Cardiology. He's going to share with us this secret that most people don't know about.
Absolutely.
Greetings, John. So what is this continuum, as you've often talked about, from normal healthy person, there's this thing that occurs, then atherosclerosis starts, heart attacks and strokes. What is this called?
There's many things that contribute to plaque and to the buildup of plaque, and we've known for many years that diabetes plays a crucial role there as a co-conspirator in contributing to plaque formation. But diabetes is simply the tip of the iceberg.
What is the, so we have a picture of an iceberg floating, the tip is diabetes, what's underwater?
So what we now understand, and this is a new understanding over the last several years, is that long before anyone ever becomes frankly diabetic with high blood sugars, is that the person has been pre-diabetic for 10, 12, 20 years before they ever become frankly diabetic. Now here's the problem. During that period where they're pre-diabetic, they are busy building up plaque just as well as someone who's frankly diabetic.
So this period of time between healthy and starting to really drive atherosclerosis, what is it called during that period of time?
Metabolic syndrome or metabetes.
Metabetes, we'll use just because it's a quicker, easier word to use. Metabetes, what is metabetes?
So metabetes is really insulin resistance or pre-diabetes.
Okay, insulin resistance. Let's try to make this come alive for the people who are watching this. So here it is, I'm born, and as I grow, I make new fat cells up until what age?
About 18 months.
18 months of age. So now as I continue to grow, I don't get more fat cells, but the fat cells I have can get bigger and smaller, right? So at some point, my fat cells are full or resistant to taking in more food, and at that moment, I have
metabetes.
Okay, so let's follow the food. Let's help this come alive. Food goes in my mouth. I go to a fast food restaurant. I pull up. I get my fries and hamburger. I'm eating. Tell me what happens. The food goes in my mouth, in my stomach, and it's then into the blood. What happens next as that energy goes in through the blood?
What happens is your body responds to that, and you begin to produce insulin.
Insulin. Now, what does the insulin do?
Insulin is a very important hormone. It is a hormone that allows us to absorb energy from our food.
Okay, so it tells what cells in our body to do what?
Particularly the muscle and the fat cells to turn on signals to absorb that energy.
So the fat cells and the muscle cells and the liver, as an example, start pulling the food I just ate from my fast food restaurant out of the blood.
Yes.
And the problem, I guess, occurs when my fat cells are full. What happens to that energy?
When your fat cells are fat, they don't respond to insulin anymore.
And so what does the body do at that moment?
So when your body doesn't respond to insulin anymore, like getting hard of hearing, you turn up the volume. Your body begins to crank out even more insulin.
And so more insulin increases in the body. Then what happens?
Well, the problem is, like being hard of hearing, as you turn up the volume to hear better, you're damaging your ear. So as your body creates more insulin, you actually make yourself more insulin resistant.
Oh my goodness. So and at some point that energy has to be dealt with that's in the blood. So where does it sometimes get stuck that can lead to further problems?
Well, it begins to get deposited all over our body, but particularly the belly, and we begin to see abdominal obesity or visceral adiposity, different terms, but basically it's the beer belly kind of look.
I always used to tell my patients as a family doctor, if you get naked in front of the mirror and you turn sideways and your belly button sticks out further than your nose, you got a problem.
You got a problem. You got the belly of death.
You can't lean forward. Okay, so one thing that happens is that your belly starts to grow. Where else is the energy deposited in the body?
It gets deposited in the liver, You get fatty liver.
Mm-hmm.
You also, it even gets deposited within the heart. You actually get fatty heart. And for a heart specialist such as myself, all that energy, that fat, gets deposited in the blood vessels.
In the blood vessels.
Causing plaque.
And that is what drives plaque, huh?
Yes.
So now we've connected the dots from the point where we eat the food, it flows in, it actually goes around, starts to drive the plaque, and the plaque is now called atherosclerosis, and that's what kills us, huh? Mm-hmm. So is there an opportunity here?
Only half of Americans.
Only half of us, that's right. The other half die of something else, so in half the time. But also, many people die of other things that had heart disease too, so it affects.
Well, yeah,
I'm
talking about the half of us that die of that disease. Many of us more will have it, but half of it'll actually be on our death certificate.
Well, if we want to live a vital life, it's probably good to not have it, right?
Absolutely.
All right.
Best avoided.
So let's take a step back and ask the question, during this time when the extra fat hasn't yet started to turn into plaque, is there an opportunity here to do something about that, to prevent the next step from occurring?
Well, that's been the big breakthrough, to understand it's not just diabetes, which is really just a further stage of this whole process, but to understand, identify people before they ever become diabetic in the pre-diabetic state or the metabolic syndromes.
So if we can find them with diabetes, we can help them not get heart attacks and strokes. Is that right?
Yes, and even help prevent diabetes.
Of course, that makes great sense. So what do we do? What do we look for? If I'm watching this CVTV and I go, I don't want that, I don't want to have that, how do I find it?
It's really simple. 5 simple things.
1.
High blood pressure.
Check the blood pressure if it's greater than
130 on the top or 85 on the bottom.
2.
Impaired fasting blood sugar, that is blood sugars fasting between 100 to 125 is not normal. Above 125 is diabetes.
3.
High triglycerides, greater than 150.
4.
Low levels of good or protective cholesterol, that's the HDL cholesterol, when it's less than 40 in a male and less than 50 in a female.
And 5.
Weight around the belly. Now the best way to measure that is with a tape measure. You get out a tape measure, and if your waist, you're around your at basically the level of your belly button, is more than 35 inches as a woman, or more than 40 inches for a male, that's the 5th component of metabolic syndrome.
So do I have to have all 5 of those?
No. Of those things we mentioned, and you can see them on the screen now, of those 5, only you need 3 of those, and you've got metabolic syndrome.
Okay, so if I go to my doctor and they check my blood work and I have any of those, but particularly if I have 3 of those, and for sure if I have 4 or 5, I'm in this place where I'm starting to create, and the probability I'm either going to get diabetes or just develop a lot of plaque and have a heart attack or stroke.
Both.
Both. Oh, you can have both. Great.
You're going to get both.
What percentage of people, when they're diagnosed with diabetes, already have heart disease?
50%.
What percentage of people with diabetes die of heart disease?
80%.
Okay, so I got it. So these are kind of sisters of the same mother kind of idea concept, huh? Mm-hmm. All right. So what do I do about this? This is kind of scary.
The first step is understanding.
Okay.
You've got to know if you got the problem.
And I got it. So I got it. Let's say I got it that I got it.
Right.
So what do I do next?
So the first things we want to do is many times we're going to focus on what we're eating, how much we're eating. We need to focus on the exercise. Those are going to be the first core things we're going to focus on.
Okay, so said another way, what I just heard you say was that if I change what I take in, or when I take that in, there's room in my fat cells, I fix the problem.
Yes.
Okay, so how do I know what to take in?
Well, the things that are particularly bad for people with metabolic syndrome or diabetes are sugars and simple carbohydrates. Simple carbohydrates are basically starches.
Okay, so bread, rice, pasta, potatoes,
Yes.
corns,
Yep.
cookies, cakes, chips, soft drinks.
Right.
Anything else I missed?
Oh, there are others, but if you focus on those, that'll get you well down the road.
I'm sure many people watching us right now are going, wait a minute, what else is there? You just eliminated my entire diet. So I guess let's look at the other side of the coin, because if your fat cells are empty or they have a lot of room, then you can get away with eating some of those, just not too much, right? How do I empty my fat cells?
How do you empty it? Is exercise.
Exercise, and so if I'm exercising regularly, maybe what? How many minutes per day?
I tell people really it should be every day, for at least a half an hour.
Okay. And does exercise mean going, putting on one of those tight suits and
I
lifting
tell
weights?
people keep it really simple. Every day, total of 30 minutes. You can break it up into different segments. And frankly, all I ask is that I don't care what you do. Running, walking, hiking, biking, swimming, jogging, skateboarding, kayaking, pole vaulting, extreme gardening. Get your heart rate up, get hot and sweaty.
Okay.
Okay? Don't worry about heart rate. Don't measure, forget about your heart rate. Just get it up, get hot and sweaty. Know that at the end of that half an hour, or maybe 2 15 segments, one in the morning, one at night, that at the end of that, you feel appropriately tired and fatigued. Not going to die, but appropriately tired and fatigued. That's what we're looking for. And if you do that every day, dramatic effects in reducing the risk of developing diabetes, or if you have diabetes, dramatic effects in reducing your blood sugar and at the same time helping your blood pressure and cholesterol.
The other thing, I suppose, that the balance between what you're taking in and what you're burning appears as your weight. So the other good thing about this is you'll start losing weight.
Right.
Okay. So if we're working on that, or while we're working on that.
And in fact, if you lose 10% of your body weight total,
okay,
you're going to lose 30% of the fat in the belly.
So
and this is the deadly fat.
So if I weigh 200 pounds, if I get down to 180, then I'm going to get rid of my deadly fat.
You're going to get rid of
30%
total weight. You're going to lose 20 pounds, but you're going to lose 30% of that fat in the belly.
Okay, well, that sounds good. So then, are there medications that I should think about taking while I'm doing these things?
There are medications that are approved for weight loss, such as a drug called Xenical, which is a fat blocker. There's also a drug called Meridia as well that has been shown to be helpful in helping people lose weight.
Things that help me lose weight. Are there things that help me control sugar?
There's a variety of medications we can use to treat and help prevent, both treat diabetes, as well as there's good data to show we can even help prevent diabetes with certain medications.
Is there something to get my triglycerides down and get my good cholesterol up?
Absolutely. Again, everything from omega-3 fatty acids or fish oils can help with that, to niacin, vitamin B3, and then there's a variety of medications that can also be useful too.
Okay, are there any medications that make this worse, that aggravate the problem?
There are certain medications that can make this worse, and that's why you need to discuss this with your physician.
All right. So we have normal, we have metabolic syndrome or metabetes, and then that branches off into diabetes, heart disease, or both.
Right.
And that's the dirty little secret, is that we can find this metabetes and treat it and keep those things from happening. Is that what you're saying?
Absolutely.
Dr. John Osborne, thank you so much for being here today. And I hope as you watch this and you hear this, you're asking the question, what's my waist? What's my HDL? What's my triglycerides? What is my blood sugar? And what is my blood pressure? Go find out, because if you know that those aren't in the right place, you could already have developed heart disease. You could already have developed blockage in your head, and you could be in a place where the first symptom you have is a very bad thing for you and your family. So go find out if you have metabetes, and let's get it all fixed.